Hi, I'm Dr. Ashish Davalbhakta, plastic surgeon, director of Aesthetics MediSpa, and professor of the fellowship course in aesthetic plastic surgery, which comes under the Maharashtra University of Health Sciences. Today, I'm going to be talking to you about facial rejuvenation, the art and science behind it. There's a lot of confusion, there's a lot of lack of awareness about facial aging, and people come asking to us, they want to look younger but they don't know exactly what's happening. So today I'll spend some time and explain to you what we look at when we are considering facial aging and how we should go about trying to correct that. So I'm going to point you towards this screen here, and this is an artist's description or a depiction of the aging process. Now, if an artist can actually show person of various ages, there must be definitely certain changes that happen that make you look older. Mind is like a computer, and it takes in 1,000 plus signals from the face when you meet someone, and it is trying to ascertain how old this person is, and it happens subconsciously, and that's exactly what the artist is showing here. So if you see person who's maybe in their 20s and then 40s and 70s, you can see the various changes that are happening. And the three things that happen when you grow old is, one, the skin becomes inelastic, you start losing your normal fat pockets of your face, and then that inelastic envelope, it sags down, it's due to gravity. So these three changes are happening and you need to reverse them. Now, I divide the face into 5 zones. The forehead is one zone. If you look here, forehead, which includes the eyebrow, is one zone, and because of thinning of the skin and loss of fat, the muscles which are underneath the forehead skin, they cause wrinkling of the forehead, and you can see the frown lines which are happening because of the glabellar muscles, and constant activity of the muscles, they cause buckling of the skin, and that's how, where it buckles, the skin thins and it becomes wrinkled or it becomes grooved. And if you don't address it, if you don't prevent it at the right time, you can have progressive thinning of the skin and an irreversible change. So there are other things that have to be done for them, but you can prevent it. Coming to zone 2, which is around the eyes, you can see that there is a volume loss happening. You can see the subbrow volume loss and the loss of underneath the lower eyelids as well, and there is laxity of the skin which gives rise to wrinkles and folds, and I'll show you in some of the patients how you can identify them. Coming to zone 3, which is the mid face, extends from the eye to the jawline, the change that you see is a vertical descent. There's things going down, and you start seeing nasolabial folds, marionette lines and jowls, and loss of volume in the malar or the cheek area, and these things are manifest in zone 3 or the mid face. Zone 4 is around the lips, and what you see here is thinning of the lips, and you see vertical raggeds or lines appearing. Zone 5 is the neck, and here you see typically transverse neck lines, or even you may see bands which are called platysmal bands, as you can see here. These are platysmal bands which become very prominent, and if you don't address them in time, they can become like the horse's reins, and it's a definite sign of aging. So these are by and large the signs of aging. Now, if you look at this picture here, this depicts the normal fat pockets of the face. So underneath the skin, there is a uniform layer of fat. We as surgeons, plastic surgeons, we identify them as different fat pockets: forehead fat, and then there is the subbrow fat and lower eyelid fat, which is called the SOOF, and then you have the nasolabial fat pad, you have got the mid cheek fat pad which runs right around up to there, and then these are the marionette lines or fat pads. So there are a lot of fat pads normally present, and they shrink, and one of the methods of correcting that shrinkage is filling. So you can fill either a synthetic ready-made hyaluronic acid filler, which is a very inert filler, or you can fill with fat, which is your own natural tissue. You take it from maybe tummy or flanks or inner thighs, process it and inject. 50% to 70% stays, and usually stays permanently. So these are various things that we do, and I'm going to take you through a series of patients and teach you how to analyze the aging and what are the things that are done to rectify that. So if you look at this lady, and if you see that, forehead, she's got lines, and she's got frown lines, which I told you are in the zone 1. She's got loose, lax skin in the upper eyelid. Deflation has happened there. You can see transverse lines in the lower eyelid area, and she's got nasolabial folds and then marionette lines and very lax and scraggy neck in the lower part. So this is the aging that she has had, and she's had this at a very young age, and this is probably because of environmental factors or genetic factors. But if you address all the 5 zones, you can see the kind of rejuvenation we can do. You can see that we have treated this with a neuromodulator, Botox, Xeomin, or one of them, on the forehead to reduce the forehead lines, and I've done an upper and lower eyelid blepharoplasty. I've done a facelift, which is the deep subsmash, extended subsmash facelift that I do. I've treated her upper lip lines with laser, and I've treated her neck as well. So this is a nice and harmonious change. Now if you look at her from the side view, you can see all the changes that I had mentioned, and this is the appearance after correction. Now you can see that the changes are fairly harmonious, and you can barely see the facelift line. So she's had upper and lower eyelid bleph and a facelift, and it has rectified her neck skin as well. So look at the way her neck skin is, and you can see after the facelift. So it does set you back by nearly 15 to 20 years in age, and then you would age from that time onwards. So it's a very permanent kind of a correction. On the other hand, you may find some patients like these who have had a lot of weight loss, and in the weight loss, obviously the natural fat pockets of their face, they shrink. So you can see the deflation has happened here. Too much of the eyelid is visible because the volume, the roof fat has gone. You can see the deflation there, and the laxity that is manifest, nasolabial lines, marionette lines, jowls. Not too many changes in the neck though. And this is the appearance after we have done fat grafting around the eyes and the temple and the mid face and the marionette, and along with that we have done tightening of the upper and lower eyelids, a facelift and a neck lift done separately. So volume addition is very important, and if you see the kind of volume, it gives you not only a stem cell effect which rejuvenates the skin, overlying skin, it makes the skin look healthy, and it's like filling and tightening at the same time, which gives you the appearance of youth. So this is the kind of ultimate in facial rejuvenation at the moment. But analysis is very important. As you can see here, a lot of laxity in the upper eyelid, causing an almost a fold, and it makes your eyes look tired. When you wake up in the morning, sometimes there's swelling. People ask, are you tired? When you're not. You can see the laxity in the lower eyelid, the tear troughs that are there, the crow's feet, and then you can see the downward droop or the marionette lines which have happened because of the downwards and forward shift of the skin. So this is a patient who's crying out for a facelift, and if you are having these problems, then don't hesitate to come forward and ask us, and we would be happy to help you with a facelift in this fashion. And it is a life-changing experience once all the swelling has settled. It may take up to 2 months for things to settle down, and once they do, you can see the kind of tired and aged appearance, and every time you look in the mirror you feel you're a lot older than you actually are. And then they send me pictures like these after comprehensive facial rejuvenation that we specialize in, and it is really getting back to the youthful days that you so desire. Another patient who's already had a blepharoplasty earlier, So same change signs you can see, jowls and the vertical descent, nasolabial folds and the marionette lines, and this is the appearance after a facelift and fat grafting periorbital. So this is a significant improvement, but you have to address all the zones, and you can see the change here in this picture. So yeah, so that's a little bit about facial rejuvenation. In another talk, in another maybe session, I will cover non-surgical rejuvenation. As I said, filling and neuromodulators are there, but there are other devices where you can expect some skin tightening to happen. The skin tightening that you get is moderate, is from mild to moderate. I wouldn't say only moderate, but from mild to moderate tightening you may get. You need sessions of those. The improvement you get is never as dramatic as you get in proper surgical correction. But if you are absolutely against having any surgical intervention, then there are techniques that we can explore. In another session, I think we will cover those. Thank you very much.